All right, sinus rhythms, sinus tachycardia. Our objectives for this module will be define sinus tachycardia and discuss the differences between sinus tachycardia and normal sinus rhythm. Define the TP wave and discuss morphologic differences it can cause on the appearance of a complex on a rhythm strip or ECG. Discuss the physiologic and morphologic changes that occur in the complex between a normal sinus rhythm and a sinus tachycardia. List some clinical conditions or circumstances that are associated with the formation of a sinus tachycardia. Accurately identify sinus tachycardia on a rhythm strip or ECG, and explain the target treatment of sinus tachycardia, which is identifying and treating the underlying cause. So sinus tachycardia follows all the rules of normal sinus rhythm except for the rate. So the only difference here is that now the rate's going to be greater than 100. It won't be between 60 and 100, but it'll be greater than 100. The P waves and the PR intervals will be identical. The TP segments are short, or the time between the T wave and the P wave, and that's because you've got more complexes showing up. Your rates are typically between 100 and 160. It says that it can be as high as 220, but it's awfully hard to identify sinus tachycardia when the rate is that high. Now, one thing I want to talk about is the TP wave. So the atrial repolarization wave, we typically won't see this. The TP wave is normally buried in the QRS, but sometimes the tachycardia can get so fast that the wave actually is superimposed on the ST segment, and it can cause it to be depressed, and you may even see it sometimes as like a little indenture right there. But essentially, this is not going to be a significant thing that we're going to look for in the ECG. So your rules. What is the rate for sinus tachycardia? Your rate's going to be typically 100 to 160, greater than 100 for sure. Your atrial rhythm will be regular. Your ventricular rhythm will be regular. The P waves are going to be upright and uniform. There will be a P wave before each QRS. The length of the PR interval should be 0.12 to 0.20 seconds, and the QRS complex should be 0.12 seconds or less. This is the same thing that we just mentioned. The P wave, the morphology should be the same. You should have one P wave to one QRS. You'll have a normal consistent PR interval. QRS width is typically going to be normal, and there won't be any grouping or drop beats. So what are some things that can cause it? Exercise, anxiety or stress, fever, hypoxemia, decreased ventilation, hyperthermia or fever, hypotension, certain drugs, especially drugs that are stimulants, some anticholinergic drugs as well, anemia, hyperthyroidism, congestive heart failure, acute myocardial infarction, and any other thing that stimulates sympathetic activity. Now, what you've noticed or should have noticed here is that all of these causes of sinus tachycardia are typically not going to be cardiac in origin. And so the treatment for sinus tachycardia is always going to be to identify the underlying cause of the sinus tachycardia. So let's take a look at one. So if you notice on this sinus tachycardia rhythm, it is a 6-second strip. I've got a 3-second and a 3-second, which gives me a total of 6 seconds. So what's my rate? Let's count it. 6, 7, 8, 9, 10, 11, 12 is 120. Is it regular? Yes, it is regular. P wave is present, uniform, upright. What about my PR interval? Well, let's measure. We'll find one that falls on a good line. We'll measure this one here. So I'm going to measure from there until there, and that gives me about 0.16. And then my QRS, my shape and length, the shape looks normal, and my length from right here to about right here, 0.08 seconds. So, looking at the rules, my rate, it breaks that rule because it's greater than 100. It is regular, so we're good there. The P wave is good, the PR interval is good, and the QRS shape and length are all good. So that makes this a sinus tachycardia. So let's look at some more examples. So on this one, this one's a little bit tricky because the textbook didn't give you a full 6-second strip here. So what you would need to do is take your calipers and see if another complex would fall in between the 6-second strip, and it would. So I'd add an additional complex there at the front. So this rate's going to be at least 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 110. So the additional complex would fall right in there. What about my regularity? Well, let's take our calipers and look. So measuring every R to R shows that it is regular. What about my P wave? Well, all of my P waves are good. They're uniform, upright. Present. PRI, I'll measure this one. So I've got 1, 2, 3, 3.5 boxes. So I've got a PRI of 0.14 seconds, and I've got a QRS of this is a small QRS, which is to be expected sometimes in sinus tachycardias because it is going so fast. So the ventricle really doesn't have a lot of time to contract. So the QRS is 0.04 seconds. So let's look at the rules. We break the rate rule. It's good on its regularity, its P wave, its PRI, and its QRS. So following those rules, this would be a sinus tachycardia. Let's look at another one. Again, they didn't give us a full strip on the 6 second, so using my calipers, I would note that if it is regular, my next QRS complex should be right in here. And then I'll even have another one at the end of the strip as well, right in here. So my rate would be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So my rate is 130. It is regular. I've already checked. My P wave is present, upright, and uniform. My PRI and my QRS is next. So my PRI, I'm measuring on this one right here. So I'm measuring from right here to the middle of those two blocks. So it's 0.14. And my QRS is going to be 0.06 seconds. So my rate breaks the rule, my rhythm is good, my P wave is good, my PR is good, and my QRS is good. So I've got sinus tachycardia. Another example. So again, we've run into the same issue. We should have a complex right at the beginning. There's not enough room on the end, so I know there's not one there, but I will count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So my rate's 120. It is regular. My P waves are all sinus P waves. My PRI looks like it's about 0.16, and my QRS is about 0.08. So this again makes this a sinus tachycardia. I'm going to skip on down a few and we'll look at this one. So this one should have another complex right here and should have another complex right here at the end as well. So my rate is 140. My rhythm is regular. My P waves, they all, even though they're kind of merged in right here, they're all looking okay. My PRI is kind of hard to determine, but it starts about right here, and so it looks a little narrow, so 0.12, and then my QRS would be from here to about right here, which is 0.08. So this is a sinus tachy, but I'm sure you notice that it doesn't look like some of the other sinus tachycardias that we've looked at. And what you're actually seeing here is ST elevation, which we'll get into in the future, but this is a sinus tachycardia with some pretty significant ST elevation. So the clinical significance of sinus tachycardia, just like I mentioned at the beginning of this lecture, most of your sinus tachycardias are going to be caused by some other cause. Sinus tachycardia is usually secondary. It's usually not a cardiac issue, and it doesn't need to be treated as such. What we need to do when we notice that the patient is experiencing a sinus tachycardia is that we need to figure out what the underlying cause is and treat the underlying cause, and in most cases that will slow the tachycardia down.